A child can develop communication problems for all sorts of reasons. It could be a simple speech impediment or language barrier, or it could be something more complex with an underlying condition like autism. Either way, it's very common for children to need speech or hearing therapy, and that's where my next guest can help. Janelle Pickens is the owner of Cornerstone Speech Therapy, and she joins me today along with Angie Morris. Ladies, it's nice to have you here.
Thank you for having us.
Janelle, let me start with that basic question that all parents want to know. When their child is starting to talk and they don't know if it's a little delayed and they're not talking as quickly as other children, when do they need to be concerned, and when is it just, you know, they're just a little slower, it's no big deal?
Well, what we know is that the earlier the better for early intervention. So if you are concerned at all, if you take your child to have an evaluation completed by a speech therapist, they'll be able to better guide you to determine whether or not they feel a delay is at hand or if there's a further underlying disorder going on.
So there's really no reason not to find
Absolutely.
out. There's peace of mind there, I would think.
That's my number one advice, is being proactive.
Okay.
We know that the most learning occurs under the age of 5, so the more that you can do at that age, the better.
Well, that's another question then. They're so young. First of all, how do you get them to pay attention? And can they really learn something at age 5?
Right, and I get that question a lot. People call us a lot and say, our pediatrician said they need speech therapy, but they're not even talking, so how in the world are you going to help? I think a lot of people have in their mind that speech therapy is that little office down the hall where you go and you work on your R's and S's. But really what we do is much more than that. And my specialty is in early intervention, which is 0 to 3, and it's all based on play. It looks like maybe we aren't really doing anything in particular, but that's what we know. How children learn at that age is through their daily routines and their activities. So that's
and it can be done. I mean, they learn that way. They learn through play.
That is how children learn. That is their work.
Angie, you are an community outreach specialist for the school. What does that mean? What is your role then?
Really, I go and talk to other organizations that work with kids with delays and outreach them, see how we can help them and how we can meet with those parents and help those parents.
So for parents that maybe don't understand that they have some issues, you are there letting them know this is what we can offer.
Here's how we can help, and if we can't help you, here's how we'll help you find what you need.
You don't go to schools, though.
We don't.
Give
go
me
to
an
schools
example
right
of who you'd work with then, Angie.
We work with Flying Horse Farms. We work with the Autism Society. We work with the Down syndrome.
So these would be children with special disabilities, special needs, and then this is one of those needs that they have to take care of.
Yeah.
Yes.
How long does it go on, Janelle? I mean, for a child, I suppose it depends on the child, but also what you're dealing with that child.
That is a very tough question, and that's a question I get a lot from families. They want to know, how long is this going to be? Okay, we have 6 months, you know, what's the prognosis? And I wish I could give people that answer, but like I said, if the earlier the better for better progress. So if you are able to get your child in for help sooner, then most likely that success will come more quickly for that child.
Angie, what should a family then expect when they first come to you, or you approach them about coming to the center?
Well, they'll come to us and I'll have them call, and we have free screenings that we can do and evaluations, so we'll set them up with a therapist.
There's the
office. There's our therapist.
Yes, located in Powell.
And so,
go ahead.
Go.
I should emphasize too that most of our services are home-based. While we have an office in Powell, it is set up like a home to feel comfortable for children, but we believe in working in the natural environment and including the family in everything that we do, because we know that's where children learn the best. So most of what we do is actually in the home around the Central Ohio area.
Do you sometimes do both? They come to the center and you go to the home?
Sure. For children under the age of 3, we really prefer that they be in the home because that's such an intimidating thing for them to go to a center or to a clinic.
Yes.
But over the age of 3, we do see children in our office setting if that works better for the family.
And so, Angie, how do families feel about that, knowing that you folks can go into their home, make it more personal, especially for the youngsters?
Some of them love it because they're in their environment, so it's not as scary for the kid, not thinking it's a doctor or who's going, even though the office looks like a house, looks like a home, when we go to their houses, they seem...
It's their house.
It's their house.
They're in their space, and they can show you, here's my stuff, and
that's right.
The kids seem to open up a little more. And
well, Janelle, you have some special things coming on for the summer, too, that we want to let our viewers know about.
We do. First of all, I should say that May is Better Hearing and Speech Month, so we are offering free screenings at our office in Powell. And we also have summer programs available. If you go online, cornerstonespeechtherapy.com, we have a program called Social Bugs, which we're working together with Rejoicing to put together a little summer group. And also we have the Art of Communication group, where we're working on speech and language with the context of art and making projects together.
So nothing like the present to reach out to you folks if people have questions.
Absolutely.
It's nothing but just helping their child.
Please give us a call. We'd love to help you.
Thank you, Janelle, Angie. Nice to talk with you, ladies.
Wonderful. Thank you.